As fentanyl overdose deaths continue to rise in Oklahoma, experts are urging people to have naloxone on hand to stop them. In this morning's The Hot Seat, Scott Mitchell explains some of the reasons for the increase in this very dangerous drug.
And good morning. Welcome to Hot Seat. I'm Scott Mitchell. Last week, we discussed with behavioral health expert Jeff Dismukes a problem with fentanyl and how it's getting much worse. Earlier this week, I had a conversation with Denica Kane of the CDC's foundation about the ominous signs that are taking place right here in Oklahoma. Here's the excerpts from that conversation, and you can see the entire conversation at news9.com and newson6.com. Denica, how bad is the problem in Oklahoma? Is there a reason for it being bad in Oklahoma? And what do we need to know really soon about fentanyl?
I would say the problem is getting worse and worse. When we look at the data from the Department of Mental Health in our emergency rooms and hospitals, and from our medical examiners, Oklahoma had the highest rate of overdose death increase over the past few years from the pandemic, second only to Maine. And we are seeing now for the first time that fentanyl is actually in more of the substances that are being used that are causing death than methamphetamine. So this is the first for Oklahoma that fentanyl is leading the way. We're about 2 years behind the other states in the country on how we're seeing some of these substances and what is impacting us the most. And so we have to start paying attention to what is going on there. And now even we are starting to see, in addition to fentanyl, we are starting to see other types of substances like xylazine. Just in the first half of 2023, we're starting to see xylazine, which is a veterinary medication that mimics fentanyl, as another derivative that is also present in causing the death of Oklahomans. Fentanyl is easy to get. It's cheap. It creates a much greater high. All of our DEA and HIDTA drug enforcement folks are telling us that fentanyl, because it is so cheap and easy to get, that it is something that they are cutting other substances with. So not only do we have fentanyl in its illicit means and mechanism on its own that people are seeking out, they are now using fentanyl as a cutting agent with heroin and other opiates and cocaine and methamphetamine, and it is causing massive problems. So people may not even know that they're getting fentanyl, or may not even be searching it out. And because it is so potent and so deadly, it is causing an overdose to somebody who may not have otherwise been susceptible to an overdose.
I'm seeing news reports, that it's very clear that there is a lot of naloxone, I believe that's the way you pronounce it, that has been out, and the messages have been good about overdoses. But the level of this drug going into things, people overdosing, that one dose isn't doing it anymore. Can either of you help me with that information? I mean, how accurate is that? How much of a worry is that?
I think it's very concerning. I mean, based on the strength of the fentanyl that we're seeing, and based on how much is being used to cut into other substances, it is requiring more than one dose of naloxone to pull somebody out of an overdose. And I have heard reports of, multiple times of people having to administer multiple doses of naloxone to pull somebody out of an overdose. And we're seeing that from our first responders are telling us that. Law enforcement is telling us that, and hospitals are telling us that. And so while that harm reduction strategy is helpful and saving people's lives, because the substance is so strong, because fentanyl is so potent, it is requiring multiple uses of naloxone to actually pull somebody out and save their lives. So it's something we've got to watch and pay attention to, and look at how many of those doses are actually being used on individual people, so that we can also determine what some of the strengths and purity levels of some of the substances are. I mean, that's the kind of thing that we're seeing across the board. Our methamphetamine now is actually a lot more potent and strong. If you talk to our urgent recovery centers or our crisis centers, they will tell you that they're seeing people who have used 1 or 2 times and it is already inducing psychosis. And it's really difficult to pull somebody out of there. Now, it can be done. It can absolutely be done. It can absolutely be treated. It is something that people can recover from, but it becomes much, much more difficult and a much higher risk of death based on the strength and purity of the substance that we're seeing.
One of the other points to that, though, also to remember with the naloxone that you're able to get, and it's available for free in a couple different ways across the state. They have vending machines with this now, but you can also go to okimready.org and order free naloxone to have in your home. And anybody that is taking opiate medications should have this in the home, or if you have a loved one that you're concerned about.
Thanks for watching. See this again at news9.com and news16.com, and follow me on my socials at Mitchell Talks.